Welcome to the launch of the Australian Centre for Integration of Oral Health, or what we'd like to call ACIO, in celebration of a World Oral Health Day, which is happening this weekend. For those of you who don't know me, my name is ACIOH George, and I'll be chairing this event. Thank you all for attending in person, especially those online as well. I think we have about 45 plus people so far. And I'd like to give a special thanks to the Australian Dental Industry Association for allowing us to hold this launch during their national event. Before I commence the proceedings today, I'd like to acknowledge the traditional owners of the land and all the lands on which we are standing on during this event. Here at the International Convention Centre, Sydney, we are meeting on the land of the Gadigal clan of the Eora Nation. I would also like to acknowledge and pay my respects to elders both past and present, and in particular, any Aboriginal and Torres Strait Islander people meeting here face-to-face and online. So just a bit of housekeeping. Today's event will have two sessions. The first session will involve a few short presentations from the ACIO executive team, followed by three guest speakers. One of the guest speakers is in person, the other two is online. The second session, which I'm hoping will start around 6:30 or maybe just after 6:30, will be a networking event for those attending in person, along with photos and some interviews. So please try and stay for the networking event. For those of you online, please keep your mics muted, and I encourage you to use the chat function. We do have an administrator who is monitoring the Zoom, so if you have any issues, please send us a message. Refreshments, as you can see, will be served during the event. So let me first introduce our first speaker, Associate Professor Rachel Martin, who is going to provide you a bit of history behind the establishment of ACIO. Rachel is a dentist and a specialist in public health dentistry. Her strategic leadership in integrated oral health and person-centered healthcare includes founding and convening a series of conferences influencing consumer participation across the health sector. It was during this period that I met Rachel, and in 2017, with our colleagues, Hani Kailash and Bradley Christian, we founded the Network for Integration of Oral Health, or NEO. I'd like now to hand over to Rachel to share a few words. Thank you, Rachel.
Thank you, ACIOH, and welcome everyone here and on Zoom. So in 2017, we first gathered from across Australia, and some of us here today, many of us here today, were amongst that group of clinicians and academics and health promotion workers and others, all committed to making the mouth matter in health. And we called ourselves a network, but we were a bit of a motley bunch, however, all passionate about putting the mouth back into the body. We worked together over 3 years, and by the end of 2019, we officially launched the Network for the Integration of Oral Health, and we had formalised our vision, mission, aim and objectives. We even produced a consensus statement outlining the key elements for the integration of oral health. So we know what we need to do, and we know that no one person alone is going to change the way that oral disease is managed. What is needed is a collective effort from many perspectives. This is social change that we're making. We need shifts in attitudes, behaviours and practices of so many different people and groups of people. And today we're here to celebrate our progression in the journey of how we are creating this social impact. Recently, when I pulled out the timeline that we developed through NEO, it struck me that despite what seemed to have been many disappointments over the last couple of years of this pandemic, as a collective, we are actually moving in the direction we need to go. And so here we are to celebrate and launch the second phase of the network's expansion plan, the Australian Centre for the Integration of Oral Health, which was actually established early last year. So to tell you more about this, I will introduce Professor ACIOH George, our colleague and friend on this journey. ACIOH has more than a decade of experience working in the interdisciplinary oral health space at Western Sydney Uni. He is one of the leading experts in Australia in providing oral health training to nurses and midwives and translating oral health guidelines into their practice. ACIOH and his remarkable team, some of you who are here today, have a long history of successful partnerships with industry, government and health services, breaking new ground in integrated oral health translational research. I'll also produce him out of a hat. He's going to be on the screen. Professor Hani Kalash, who heads up the oral health research stream at Deakin Uni in the Health Economics Department. And Hani has expertise in paediatrics, disability and public health and many other areas. But he has developed award-winning curricula and innovative models of oral health care, which are focused on workforce development, early assessment, prevention, and early intervention. And he's done all this. Hello, Hani, I can see you there. Up there. Hello. He's done all this through gathering national and international partners and forming essential collaborations across oral health services and programs, universities, health industry, professional associations, and government departments. Hani and ACIOH are the directors of this new virtual collaborating centre, ACIO. So I'm going to hand over to them for a few words, but I should just first congratulate ACIOH, who very excitingly has recently had a change of his professorial title and is now Professor of Interprofessional Oral Health. I believe that may be the only chair of such in Australia and the region, I think. So congratulations and welcome.
Thank you, Rachel. So I'll talk first and then I'll hand over to my colleague, Hani. So last year, the World Health Assembly approved a historic resolution on oral health, acknowledging the need to shift from the traditional curative approach towards a preventative approach within the primary healthcare system. There was general consensus that the dental profession cannot tackle the oral health inequalities and dental diseases in the community alone. These sentiments are reflected in Australia's National Oral Health Plan and many state oral health strategic plans, and has been further highlighted due to the COVID-19 pandemic. However, embracing this change has always been a challenge and has often resulted in people working in silos and either reinventing the wheel or developing strategies that are not sustainable, further delaying research translation. NEO was thus established in 2019 to try and address these issues. However, we acknowledge that advocacy and dissemination of work in this space cannot happen without a strong evidence base in interdisciplinary oral health care, hence the establishment of ACIO. Over the years, we have found that adopting a systematic approach of co-designing new models of oral health care with consumers and the broader health workforce, along with multidisciplinary collaborations with health services and policymakers, can result in programs that are not just effective in improving patient outcomes, but also sustainable and cost-effective for health services. Last year, one of those models, led by midwives, was actually recognized by the World Health Organization as a best example of integration of oral health into primary health care. And they're actually including this as a case study in their upcoming implementation guidelines. This has given us the confidence that we're on the right track and the validation that the broader health workforce can play a key role in promoting oral health. The ACIO executive team has a long track record in integrated oral health care, which has helped establish ACIO as a leading national research center in this area. Now, what is unique about ACIO is that it is an interdisciplinary collaboration between partner universities, health services, and professional organizations. Our core themes are firstly to build the capacity and capability to reorient the workforce so that the broader health workforce can play a key role in oral health, but also the dental workforce can play a bigger role in general health. In addition, through consumer involvement, we focus on developing people-centered strategies across the life course to improve the oral health and awareness of the general public. I'll now hand over to Hani to talk more specifically about our aims. Thank you.
Thank you, ACIOH. ACIO aims to provide a national platform where individuals and organizations can collaborate on integrated oral health projects with the aim of providing the oral health and overall health and well-being of Australians. sorry, with the aim of improving the oral health and overall health and well-being of Australians. This collaborative approach will help to identify researchers across the nation that are working on integrated oral health research activities and bring them together through the development of partnerships to ensure that research being undertaken in this field complements other research in this area that is occurring across other Australian universities, organizations, etc. And therefore, in this way, avoids duplication of research activities and develops research partnerships with similar interests across the nation. Two, to generate evidence for the integration of oral health across all health disciplines, including capacity building of the broader health and oral health workforce. To enhance research translation through the development, implementation, and evaluation of new integrated models of oral health care across the lifespan, and dissemination of research findings through NEO, the Australian Network for the Integration of Oral Health, and other organizations. To involve consumers and stakeholders in the research process from the outset, to ensure that the developed integrated models of oral health care are feasible, sustainable, and scalable. And to increase community oral health awareness and the competency of the workforce through the development and evaluation of relevant oral health resources, continuing professional development programs, and undergraduate training. The work that's being led by ACIO and NEO has been internationally recognized and endorsed by the World Health Organization, as well as the national interprofessional initiatives on oral health in the United States. To elaborate on the international aspects of ACIO, I would like to introduce to you Dr. Bradley Christian, who is the Deputy Director of ACIO. Brad is also the Director of Research and Innovation for the Western New South Wales Local Health District, a large health service delivery organization. He is a dentist with formal public health and epidemiology qualifications, including a PhD in health services research. Brad has both Australian and international experience in leading and managing large primary research studies and health programs.
Okay, thank you, Hani, and good evening, everyone. Yeah, it is really exciting to be at this launch of ACIO. It was about 18 months ago that ACIOH and I had the first discussion about creating a center to address a national leadership gap in the oral health integration and applied research, translation and implementation space. So as you know, there are many frameworks and strategic plans on how to integrate oral health into general health, but not many examples of actual implementation in practice. And this is really where ACIO will shine. Also, as Ajesh mentioned, there has been a lot of attention globally and locally on the burden of oral diseases. For example, the Lancet Commission series on oral health, the recent World Health Assembly's resolution on oral health, the WHO's Global Oral Health Strategy, which is being developed. And we're also starting to see oral health appear in many of our national and state level health plans. So, you know, this is, I think, the absolute time to be pushing our oral health agenda. ACIO aims to be both a local and a global leader in this space. You know, there's clear alignment with other global oral health initiatives such as IADR's Global Oral Health Inequalities Research Network, and also the International Center for Oral Health Inequalities Research and Policy in London. You know, everything we do is really about health equity, and we will strengthen these international partnerships in the near future. So to give you some examples of ACIO's international activity, you know, we have worked with the Departments of Health in Tanzania and Nepal to develop culturally appropriate oral health promotion resources around pregnancy and diabetes, which have been endorsed and disseminated. We work with the Departments of Education and Health in Timor-Leste around the implementation of an oral health promotion program for school children. We currently work with the WHO on a systematic review to identify effective approaches to integrate oral health into primary care. And we also organized through ACIOH's collaborators an Australian national response to WHO's draft global oral health strategy. And it was really motivating to see WHO actually adopt some of our recommendations and suggestions. I think if you look at that document, the first two principles or objectives clearly aligned with the language we suggested. Really, so that's all from me for now. Thank you all for being here today for the launch of ACIOH. And I will hand back to ACIOH to introduce our guest speakers for the evening. Thank you.
Bradley, so you've hopefully got a sense of what we have been doing and planning to do. So now I'd like to introduce you to our three guest speakers. So it gives me great pleasure to introduce our first speaker, Emeritus Professor Rhonda Griffiths. Rhonda was actually supposed to attend in person, but because of a last-minute caring responsibility, she has had to join via Zoom. Now, Rhonda is an experienced administrator, researcher, and educator with over 35 years as a nursing and midwifery educator. Prior to retirement, she was the Dean of the School of Nursing and Midwifery at Western Sydney University. Rhonda was appointed as a member in the General Division of the Order of Australia, AM, in 2006 for service to public health, Indigenous health, and to the nursing profession. She is a past national president and honorary life member of the Australian Diabetes Educators Association and the past national vice president of Diabetes Australia and vice president of Diabetes Australia, New South Wales. Rhonda's been quite instrumental in my career as well. She firstly employing me in early 2008 as a postdoc, and then in 2015 as the Dean, supporting formal collaborations between nursing and midwifery and public oral health services. So welcome, Rhonda. Thank you.
Thank you, Ajesh, for inviting me to speak at the launch of ACIOH. Now, the Australian Centre for Integration of Oral Healthcare, the name doesn't easily roll off the tongue, so I was very pleased that you have an acronym that will be on the tip of the tongue for those making policy and funding decisions about oral health in Australia and beyond. In Australia, we've come to expect high quality care, preferably at no or minimal cost and without long waiting times. So we're extremely fortunate in Australia to have a system of subsidised healthcare. But getting access to healthcare for many people has not always been that easy, although the attitudes are changing about who is equipped to provide care. The interdisciplinary approach with first-line assessment and education by nurses, midwives, allied health professionals, with then referrals to specialists when necessary, has been widely adopted. We only need to think about diabetes educators, about midwife clinics, and about hearing assessments. I think that it's about the rights of healthcare. It's the right of Australians to have access to the right service at the right time by the right practitioner. And as we've said earlier this evening, the Network for the Integration of Oral Health really got quite to the point with its mission to put the mouth back into the body and make oral health everybody's business. As Ajesh has alluded, most of my clinical work as a nurse and most of my early research focused on diabetes. That is where the diabetes nurse educated dietitians and community nurses provided education for the majority of people with diabetes, while general practitioners and endocrinologists provided the medical input. And I'm very pleased to see that this concept is becoming more common in oral health. It's new to oral health, just as it was new to diabetes in the early 1970s, and has been evidenced by the management of other chronic disorders. Oral care integrated into the practice of health professionals who are not dentists or oral health practitioners ticks many of the boxes relating to access, financial, and continuity of care criteria that parallels many of the models that have been put together by this centre. But to do that, health professionals who are not trained in oral health are going to require education and tools to enable them to be part of the oral health team. And no one this evening needs to be convinced that poor oral health is both a chronic and an acute health condition, which if not treated, contributes to poor general health outcomes. We've talked about nurses and midwives and other health professionals, but if we look at nurses and midwives, there are 450,000 registered nurses and midwives in Australia. So if only 10% of those practitioners have the knowledge and skills to educate people about oral health and to screen for problems and then refer to dentists and other oral health practitioners, that would mobilise a considerable force that would go a long way to providing all Australians with a regular oral health assessment. Now, of course, we can't overlook the fact that referral to dentists and to oral health services is going to put pressure on other parts of the public health system. And that's another issue that needs to be addressed, but obviously at a different time. Now, for more than a decade, as we've also said this evening, Professor Rajesh George and his teams have been working with non-dental health professionals, including midwives, nurses, diabetes educators, allied and public health practitioners, and Aboriginal health workers, designing and testing ways to integrate oral health into their practice. The design and outcome of those models have been reviewed, they've been published, and they've been translated to practice. And the evidence-based tools that have been developed and tested can quite easily be customised for a variety of other uses in a non-dental health environment. The undergraduate nursing and undergraduate midwifery programs at Western Sydney University have included an oral health module, and hopefully that will soon become part of a national-wide initiative in the education of those two groups of practitioners. The recognition and support that this work has received from organisations including the World Health Organization, the National Interprofessional Initiative on Oral Health in the US, what a mouthful that is, International Association for Dental Research, and national and state health departments in Australia, places the Australian Centre for the Integration of Oral Health in a very strong position to be recognised as the peak body for oral health research, policy and service innovation in Australia. So I congratulate everybody associated with the Centre for your commitment to improving access to oral health for all Australians, and thank the organisations who have already committed resources to enable those visions to be seen. I think with Professors Rajesh George and Hani Kailash leading activities in ACIOH and Associate Professor Rachel Martin as Director of the Network for Integrated Oral Health, I am confident that the profile of the centre is going to grow. It will hopefully attract funding for research and policy activities that will fulfil the vision to make oral health everybody's business in Australia and beyond. This centre will play a role in Australia where integrated care is the central plank to our commitment for health for all. My congratulations and best wishes on your future plans.
Thank you, Rhonda, for those kind words. I'd like to now call on the second speaker. Susanne Sofronoff is the Manager of Health Promotion Initiatives at Dental Health Services Victoria, the leading public oral health agency in Victoria. She has over 20 years working in public oral health, including 8 years in statewide health promotion manager roles, and has led national and state programs promoting oral health among non-dental professionals. Welcome, Susanne.
Thank you, Rajesh, and congratulations to ACIOH's executive team for all you have achieved, and thank you for the opportunity to speak today. From Dental Health Services Victoria's perspective, the creation of this virtual centre is an exciting initiative and very much needed. Our board chair, David Stevenson, recently released a strategic document, and one of DHSV's key strategies is to reform, build and improve the healthcare, oral healthcare through key partnerships. DHSV has a long history of working in partnership with other sectors, including peak bodies, professional organisations, universities and government groups. Our Healthy Families, Healthy Smiles team, who this year are turning 10 years, celebrating 10 years, partnered with Rajesh and his team back at the beginning in 2012. Together, they adapted the New South Wales Midwifery Initiated Oral Health Program, the MIOH, for the Victorian context, so for Victorian midwives. DHSV relied on Ajesh and his team for the evidence base for this work, and our team provided the funding and the networks that was able to make it happen on the ground. So a great partnership that's going strong, and still a highly successful program that's been recognised, as has been mentioned, by the World Health Organization. More recently, DHSV has partnered with the Australian Centre for Integration of Oral Health to review an online training program that DHSV developed for diabetes educators back in 2011. A number of leaders in their field have come together to review the evidence and support the integration of oral health as part of diabetes educators' daily practice. As a past convener of the National Oral Health Promotion Steering Group, NOPSIG as it's commonly referred to as, I can see the value add that this centre is going to provide. Many of us manage the planning, implementation and evaluation of health or prevention programs, and we often have limited time, budget and resources. So having a national virtual research centre where we can lean in and work together and support each other through research translation, building the capacity of others, inform policy and practice, will improve patients' health outcomes. Lastly, our Chief Oral Health Officer, Dr. Martin Hall, couldn't be here tonight, but wanted me to pass on this message. Congratulations, Ajesh, Bradley, Hanny, and everyone at ACIOH. It's a great initiative. Translation of evidence into practice is so important, and we look forward to collaborations in the future. Thank you.
Thank you, Susanne. Our last speaker for today is Dr. Angela Masoe, who is the Manager of Prevention and Oral Health Promotion at the Centre for Oral Health Strategy, New South Wales, Ministry of Health, the state's main public oral health organisation. Angela is a dental therapist with a Master's in Community and Health Development and PhD in Oral Health. She has extensive experience working internationally and in rural and remote regions of Australia. She joined the Ministry of Health, New South Wales in 2016. Working with individuals, communities and key stakeholders to eradicate dental caries is particularly for children and adolescents is one of her key goals. Angela leads a dedicated and committed team at CAUSE who have partnered with various universities, local health districts on many projects to integrate oral health into general health prevention and health promotion activities. Thank you, Angela.
Thank you. Thank you, Josh. New South Wales Health encourages and supports integrated approaches for prevention and health promotion activities, recognising that chronic diseases and conditions such as overweight and obesity, heart disease, stroke, cancer, diabetes, oral diseases share common risk factors, and we've heard this from our previous speakers. Western Sydney University School of Nursing and Midwifery and the Centre for Oral Health Strategy have worked collaboratively since 2009 towards creating the evidence to effectively integrate oral health information and best practices across health disciplines and agencies for improved population health outcomes. I think that's why we're all here. So CODS, or the Centre for Oral Health Strategy, has funded the instigation of the midwifery initiated oral health program in 2009, and we've heard constantly today about the benefits and the advantages of this amazing project. CODS has previously supported the Western Sydney training for graduate nursing and midwifery students and in oral health, and we've heard that from our first guest speaker. The meal program, very proudly to say, Ajesh and the team has been recognised at the World Health Organization. Again, benefits for across, like many, if we work together, many more populations across the sphere actually benefit from this partnership. Since 2009, Western Sydney, in partnership with COS, have developed 9 oral health promotion resources for at-risk populations: Aboriginal people, pregnant women, cardiovascular disease, diabetes, stroke, oral cancer, and eating disorders. Consumer consultation and health literacy considerations are pivotal processes that Western Sydney University performs seamlessly to ensure products are of high standard and culturally safe and appropriate. These can be accessed on the New South Wales Health website, where we've actually digitalised most of those resources. Communication and engagement with professional organisations such as Diabetes Australia, Stroke Foundation, National Eating Disorder Collaboration, and the Australian Dental Association New South Wales on development of health information material raises awareness at multiple levels. COS has also worked with Western Sydney University and other key stakeholders across New South Wales, for example, the Centre for Population Health on obesity, and informing the reduction of overweight in children, and the Cancer Institute to ensure that smoking cessation is actually embedded in our clinical practices, Dental Health Services Victoria, Monash Health, and Australian Diabetes Educators Association to develop an oral health training program for diabetes educators. This is a lot of work that there's a lot of work that we can still have, and there's a lot of areas in health that we can collaboratively work with the ACIO. I take this opportunity to congratulate Professor ACIOH and Rachel Martin, Hanny, Bradley Cushion, and all the teams that are working effortlessly to ensure that we integrate oral health right across all our agencies. Thank you.
So as you can see, today is a culmination of years of work bringing together universities, health services, consumers, and professional organizations across the country, all with a common goal of putting the mouth back into the body and making oral health everyone's business. It has been a long road with lots of bumps, but we've persevered thanks to the ongoing support from a number of organizations who have believed in this cause. Now, it's impossible to acknowledge all the organizations today, but from my perspective, I think it's important to name a few. For me personally, over the last 12 years, the School of Nursing and Midwifery at WSU have continued to provide unwavering support through staffing, funding, and doctoral students to drive work in this area, which has been absolutely amazing, and in my eyes, added credibility to the integration process by initiating change from within the non-dental profession. But it was equally important at the start of this journey that the dental profession was open to the idea of working with the broader health workforce. And so the formal partnerships that have formed and continued over the years with public oral health services in New South Wales, particularly like Southwestern Sydney, and Nepean Blue Mountains Local Health District Services, has been vital to drive research impact, along with the support from New South Wales Health and Dental Health Service Victoria. So Hanny and I would like to thank the ACIO and NEO executive team, which includes Rachel, Bradley, Professor Linda Slack from the School of Population and Global Health in University of Western Australia, and Dr. Meng Wong Tang from the School of Pharmacy, University of Queensland, for their support over the years, along with the amazing staff and students at the centre who've actually helped coordinate today's events. We still have a long way to go, but a change is happening. And this is clearly reflected by the number of non-dental professionals attending this event in person and online. So on that note, on behalf of the ACIO executive team, I'd like to officially launch the Australian Centre for Integration of Oral Health. We pledge to embrace the values of integrity and openness, mutual respect and trust, and commitment to collaboration as we continue to work with existing partners and new ones to integrate oral health into general health. Thank you.